Dr. Drew, appreciate you taking the time today.
It's great to be here with you, man. Thank you.
Well, listen, I think it'd be a great place to start to give viewers and listeners a little whirlwind tour of your background, and then we can, dive into this discussion around, anxiety and low mood and things that are on the rise in the population these days.
That sounds great. So, hey, everyone, I'm Drew Ramsey. I used to be a psychiatrist based in New York City, and now I'm based on the internet, which has been an adjustment for all of us in mental health. But I'm a psychiatrist, and I'm a nutritional psychiatrist, which is kind of a newish thing, although I've been at it for a while, which is thinking about mental health in terms of conventionally how we do it. I mean, I'm a general psychiatrist, but also in terms of nutrition and food, and thinking about how food can impact how we treat depression and anxiety particularly.
Yeah, we were just talking before we came on here about just how much things have changed in the last few decades around the application of nutrition, or whether it be exercise, and obviously things, lifestyle factors like sleep, and how much that science has grown to be able to highlight to us the impacts it has on mental health. And if we start this conversation from a real 30,000 foot view, and of course environment drives a lot of the behaviors that we have. And if we think of our physical environments, our food environment, even our relationships and whatnot, can you
Of that from their own life as well, of just how during different phases of the pandemic, and still it's really ongoing for so many people, that there was more insomnia. Some folks were having a hard time sleeping, a lot of catastrophic worrying, especially when you're in a relationship or have kids, that you're worrying and thinking about your partner and the risks to you. So I think everybody got a real good dose of challenge to their mental health over the last year in a way that really hasn't happened before. Specifically, I think you're speaking about what we think of, the fancy word really, I guess, is epigenetics, for this notion of how do our environments, various environments, affect genetic expression. And we know things like human connection versus isolation. Different sorts of genes get turned on in those environments. Our food environment really has so much to do with, if you think about the buzzword in medicine today, right, is inflammation, and how inflammation increasingly is getting thought of as, and really understanding as causative in some cases of depression and anxiety. But what regulates more inflammation than anything else is going to be diet, for sure. And so those environments are one area where we really think about how do we intervene in mental health, along with these other traditional treatments. I do lots of psychotherapy. I prescribe medications. I mean, there's lots of other kind of
tools in the toolbox.
Yeah, tools in the toolbox, arrows in the quiver. But it's nice that we're seeing more and more of the lifestyle approach being incorporated as we think about mental health.
Yeah, and if we use that as a jumping off point, that idea of inflammation, 2/3 of the population now are overweight or obese, and we live in this food environment where calorie dense foods are the norm, and you've got to really be swimming upstream to be looking for whole foods and making some of those choices. And so that terrain, that weight gain, that pre-diabetic or high glycemia, dyslipidemia seems to be the norm and perpetuating a lot of that inflammation. And so for yourself, when you're seeing clients, is there a certain place that you might start with someone, or is it very individual in terms of how much you think that that's impacting the mental state?
It depends a little bit where somebody is in their mental health journey. I mean, some people come to me and things are dialed in and they want to just hear some food advice. Other folks really are looking for something like a psychotherapy, or to think about some roots of their depression that, no matter how you eat, if you've had a lot of trauma, you're still going to have some work to do and things to sort through. Some folks, eat perfectly well and they still really have significant depression, and understanding strategies and ways to deal with that, or maybe more of where that's from, is important. But for most people, I start with an assessment of really two things, like, how are you as an eater? And where's your motivation, right? Do you look at me like I'm Looney Tunes when I talk about leafy greens, or do you light up and want to talk like kale massage? Do you, when I say, tell me about your fridge, and people always worry that I'm judging, and I think that's more of diagnosing, which also I think carries judgment with it, but it's more of just like, I'm just trying to figure out sort of where somebody is. And if I hear them talk about, I don't know, for example, I have some patients I treat who've never scrambled an egg.
Yeah.
And, that's really important to know before I start like waxing on about my favorite frittata and how it's so great for their brain health.
Kale frittata for breakfast.
Yeah, it's the frittata, the eggy pie is one of the best.
There you go.
So what they eat and then where their motivation is what I'm looking at. And then I'm establishing really a dietary pattern. One of the things in medicine that we've really tried to move away from is both shame-based language, but also this notion of either singular foods or nutrients running the show. I want you to eat low salt diet. Like, okay, like I want you to eat a high omega-3 fat, high magnesium, high zinc, high B12. Like it doesn't, like focusing on cutting a few things out doesn't, I don't think it helps eaters, right? Because it just sells processed food. This is no salt. This is no cholesterol. And as I look at that dietary pattern, because overall, day in, day out, what are the foods that kind of really sustain you? I'm looking for these food categories we use in nutritional psychiatry. And I cover them in the new book, Eat to Beat Depression and Anxiety. And at the end of the book, there's a plan that kind of walks through a few of them to really help. Like leafy greens is a good example. When I say leafy greens, most people think salad. But that's not at all what lettuce. Or iceberg lettuce or kale, right? Because it's me. And I had a little kale phase where, when I'm thinking leafy greens in my diet this week, I'm thinking pesto. I'm thinking of the soup that I had for lunch that had some chopped up greens in it. I'm thinking the big handfuls of oregano and rosemary that I'm pulling out of our little greenhouse and just dumping in kind of anything, any veggies I'm roasting, any pasta. So really asking people to consider what's your relationship like with that food category. And again, where is your motivation in terms of expanding things and being a little creative? And then looking for just entry points. So it's not like, wow, you've got to revamp everything, but like, hey, wow, you haven't eaten any leafy greens in a while, but it sounds like you like them a lot. What are a couple, like, when are you headed to the grocery store next? Like, how can we be a little intentional about making little small steps? You're like, wow, you've never thought about your microbiome or eaten fermented foods before. That's where it's like having people have a good experience and take little steps is really important, as opposed to what so often people do is start piling in probiotics and eating all kinds of fiber and getting gassy and then saying plants are horrible. So that's a little bit, I think, of how I try to approach things. Food categories.
Yeah. It's terrific. I was going to say, the small steps, obviously, and being able to, anytime we're trying to change a behavior, having that gap be as small as we can is definitely a big help. And, one of the things around anxiety, which really starts to blow me away, is even now we see with a lot of our young NBA players, whether they're Canadians or Americans, and struggling with things like anxiety or low mood at a really young age, which seems paradoxical, because when you think of someone who's been training their whole life, they finally make it to the NBA, they're making all this money. We would think that this is happiness, right? This is,
these guys better than that. That's not what it's like.
And so are you seeing rates of anxiety in younger populations, or?
We're seeing a couple of things. You work with NBA players, and so you see the inside of it, a little behind the scenes, where there are those moments. It's amazing, but there's also the pressure. There's also just the incredible toll it takes on their bodies. There's also the fact that you're a commodity and you're treated and traded as an object, which I just, no matter how much your team loves you and your fans love you, that's really hard on the psyche. Mm-hmm. That you've got a little moment in the sun, and it is so hard on these young men and their bodies. I think we've also had just some wonderful leadership from the NBA. Certainly Kevin Love started it, but there have been a number of players who are really speaking openly about their mental health and having panic attacks and depression. So it's been really great to see that. Your question, are we seeing more? So the rate of, I think it was the rate of suicide went down by 6% last year, which I think, I wouldn't say it surprised everyone, but I think there was a big fear there was going to be a huge surge. I'm like one of those people that, like, I don't kind of let my breath out in the movie when things look a little better. I know that, so not to be hysterical about it or worried. I do think that as things ease up a little bit, more of the processing of what we've been through, at least for me, what I'm seeing in my patients and myself, just like stuff is bubbling to the surface because it can now in a way that it didn't. If we're going to talk about folks in their teens and 20s are much more aware about mental health, but they're also facing an environment that I'm 47. It's really, and I'm really blessed. I get to treat a lot of young men and women. And so I feel, when I say like I'm blessed, it's like nice to hear about it and hear the way that people are changing everything from how folks think about relationships and relationship structure to sexuality to gender. So there's, I think, both, this new pressure and social media and all the bad stuff we hear about, but I think there's also like an opportunity more than there ever has been to be yourself and to have that honored, whatever that means to you. I would say that because there aren't as many guardrails about identity and who we are, there is more of a propensity, I think, for people to struggle with really thinking about this in ways that I think my generation in some ways didn't struggle with as much or didn't have some of those questions. And so it's a challenging time. I think that the rates of depression and anxiety, certainly in some of the data, have gone up. And I think certainly when you look at least prior to this year, what was happening, we were seeing tremendous rises in, suicide is sort of the measure that gets talked about and used. But I think it's important also to just look at straight up rates of depression. So in the US now, and I don't think this is bad. Often the statistic gets thrown around and people are like, ooh, it's horrible. But 1 in 4 women over the age of 60 take an antidepressant medication. And it's an interesting statistic for a few reasons. One is, that often gets like pronounced as like, well, we're overprescribing antidepressants. And I think that's one way to look at it. The other way to look at it is we culturally promote depression in women over the age of 50. And I think to me, that rings much more true. We just don't,
that environment situation, right?
We just have a hugely misogynistic culture and issue on our hands about that. And so certainly antidepressants aren't the way to deal with that. But when people have symptoms and symptoms of depression that stem from that, I mean, that's one of the reasons they get employed. Those are some thoughts on the prevalence and incidence of depression and anxiety and what's happening. The modern brain is up against some challenges, is I think probably what we both agree on.
Yeah. And circling back to one of your comments around identity, I think one of the things that we get if we stay on this performance side is, a younger athlete who's always been the best at their sport, and everyone tells them, you're so talented, you're so gifted, and they climb the ranks up, and which is tremendous, through high school and college, and they might finally make it to the NBA. And that's actually the first time where they're really facing a challenge where they're at the end of the bench, or they're not getting all the attention, or they might not make the team. And so that identity being so wrapped up in their being the basketball player and being the star, now that might be changed, or they might not make the team. Can you talk a little bit about how, I guess I don't know if it comes back to that fixed versus growth mindsets, but can you explore that a little bit less?
I can talk. I should tell you what it triggers in me is thinking about the challenge for all people where work becomes our identity, and particularly for men. You take away my patience, my practice, I don't know what I get to do. My wife will tell you, like, come Sunday night, sometimes I'm not the best person to be with. And it's not because I dread Monday. It's because I haven't worked in the last couple of days. And then like, I'll see some patients, I'll do some work. So they're like, how are you? I was like, I'm great. Because so much of our identity is tied up in what we do. And there's some great stuff to that. Being productive and having a professional identity. I think that's wonderful, whether it's you're a basketball player or a naturopathic doctor, or, you're speaking about as specifically as people's identity rests in being lauded. And whatever that is, whether you're the best sports, or I was talking to somebody earlier today who was like the hardest partier.
Yeah.
And as he like pulled his life into really more serious focus, there are a lot of people who are disappointed in him.
Yeah.
And so it's hard to keep perspective and have gratitude in a real way. I think it's where having people work their gratitude muscle, not in a superficial way that a lot of us do, like, I'm thankful for all this. It's like, no, like, be thankful for your big legs and your big feet and your big hands and your muscles. Like be thankful for the fact that it's just second nature that you can drop the ball in the bucket. Be thankful that you even have a shot. I think that can help with that. I think understanding when you hit your limit, like if you're in the number 10 man on the team and your job is helping your team practice, basically. I don't know. I played JV basketball. I still to this day remember the game that I got pulled into the varsity bench and thrown in and like scored 3 buckets unexpectedly, and the look on everyone's face and the feeling of it. So I think no matter where you are on the team, you get your moment, and working on being prepared for that. At least that's my sense. You work with more of those folks than I do. I've certainly seen a few in my day. And I think the folks who handle that with the most poise don't see that end goal as being number one. They see and focus on the process of being in that flow state with the body, with the mind, with the gratitude. I think those are the folks who handle it the best and often end up doing the best.
Yeah, I mean, 100%. I mean, that's definitely, our mental performance coach, Dr. Peter Jensen, always talks about that, that process and being in the moment. And I think, in past generations, maybe that building up to getting to where you needed to go, there was sort of more years built into that and more time, I guess, to build some of those mindset skills. Whereas it feels like today that progression is pretty quick, and it's you
Comes
have
at
to
a
be a bit more
cost.
cognizant, don't they, to
Yeah,
be able to.
it comes at a significant cost that to experience adolescent development in the midst of preparing to play in the NBA. It just, it has a cost to it for these young men and women. The more that organizations that benefit from those costs, the more they can do to support mental health, to support mental health services, to make sure that, we all get inspired. I love we all love to watch these players, but
100%.
I think we should all understand it. The costs, we focus so much on everything they get. And I hope that they all have access to really great mental health services as well.
Yeah, I mean, it's definitely on the rise. And, if we maybe pivot here and talk about almost the coaching staff, performance staff, or the rest of us in midlife, and how, the busyness, the madness, the long working hours, or, young kids at home, or even maybe it's caring for older parents. That can
you just
have
talk about my house tonight. It's like, it's going to get me crying here, Doc.
Like these are
okay.
Exactly right. These are all things that, from a performance standpoint, we'd say, well, that athlete's overtraining. So it's normal, like a symptom of overtraining is lower mood. But in this period of midlife, this life load adds up, right? But we don't really think of it like exercise. We just, and so
I think about it all in the same way, actually, these days.
Okay.
I have that whole work-life separation for me dissolved in the pandemic.
Yeah.
Already, I'm a psychiatrist, so I'm interested in inner world, real talk, how you feel. So I think getting in that state where we don't think, it's funny where we think about training our bodies and a little bit training our minds, but we don't then translate that to where it's most important and powerful. Like for me, it's the discipline to stop working and go help cook dinner, not just sit down. Or it's the discipline to really, in those times, engage with my kids, not just be another busy, overworked dad, and to train in the same way. Like I've been down on myself this weekend of like, the issue is you didn't have a solid schedule last weekend, of not to have my kids over schedule, but just in terms of being really intentional about, what honestly is the limited time that people get with family. These, we're coming out of the pandemic. So I think it's like, that's not probably a very popular thing to say. Everyone's like ready to get away from their family. So I think that a lot of people I spoke with really loved, it was like a gift. As much as we complain about, I don't know, like being in close proximity with family, especially if you have kids. I mean, it's just such a gift to get to spend that much time together, because usually the modern world eats that time.
100%. I think that's what people have definitely noticed despite that, accumulation. But
yeah, so I keep score. I just like reps. And I mean, in my own mind, I guess in my own way, I keep score about like the nutrition and whether I'm feeding the kids the brain food, or whether am I walking the talk or not. And I give bonus points when I combine things. Like today was a good one. I got a bunch of early work done. I had a gap in my schedule. I went to the barn with my daughter and we got our horses out and rode and did the whole horse thing. And then I raced back here, but it's like a combo of like kid time, athletic time, and like good daddy Drew, like groom my horse, like feel my feelings time. Nice. So I think at the heart of what you're saying is, how do we manage taking care of ourselves with all of the demands that come in this midlife piece, right?
Yeah, especially as it relates to low mood, because it's, we tend to just put a label on something, right? Like this person has a mental health condition, or this person has depression. And to your point earlier, all these different inputs that are influencing it, whether it's the inflammatory terrain or the lack of social, connection with friends, and lack of sleep, even we know, makes it harder to disengage from negative thoughts, all these types of things. And so, when you're looking at someone who has low mood, walk us through that complex space of the different, is it just a neurochemical imbalance, or are all these inputs having that impact on?
It's always neurochemical. Like everything that happens to us up there is neurochemical. Sure. I think, is it just an imbalance? I think certainly some people are more prone to depression or a negative bias for a lot of reasons. I think a lot of folks have had things, for example, like trauma, that puts them more prone to both depression, but also makes it harder for the things that insulate us. Like, I think about like the landscape of my patients. I mean, I was just thinking like, man, I could just walk you through like my low mood this morning. And, I think about the places I know where it came from, right? Like I was ready to get back to work. Also, I'm in some transitions. I'm thinking about a move. I'm thinking about a variety of different things. I finished a project. I know that always kind of tweaks my mood, right? So there are all these things where I'm thinking, and then I'm thinking about the biology. How was my sleep? My diet was not great over the weekend. So I think in psychiatry, we use what's called a biopsychosocial model. So I'm looking for the biological piece, right? Is there something going on with me medically that I haven't thought about? I haven't been to the doctor. Probably not, but I'll go check my B12, my iron, my thyroid. It's been a year. Is there something else going on in terms of other symptoms and severity of symptoms where I'll look at the time course, right? If I have a big crying session today because I'm upset or sad, like I'm okay with that. Even tomorrow, I'm fine with that. But if I'm crying without a good cause, multiple days, a week in a row, to me, that feels a little more biologically driven depression versus there's a really good reason. I'm crying every day because I lost somebody to the pandemic or because I'm really upset about something or, so there's, I think, time course, symptom severity. And then I think probably the mistake people make is they think that treatment equals what's so bad now you need to ... Oh, it got so bad I needed some support. Oh, it got so bad I needed therapy. Fine. Oh, it got so bad I went to see a psychiatrist. I don't know I'm curious your thoughts on how we change that culture, because it's kind of like saying, oh, I got heart disease, cancer, diabetes. I decided to go to the doctor finally.
It was time.
It was time. It's just like it kept, like, we wouldn't do that. We expect you to go to the doctor every year. And there's certain things that you do for your health. And so I hope we're seeing a shift in mental health to do more of that, where there's more of a sense of prevention and more of a sense of really partnering with people to take care of their mental health.
Yeah, I was going to say, for yourself as a psychiatrist, that seems like a real, almost daunting endpoint for a lot of patients or clients, particularly men, let's say, who, like, to your point, is like they have to get to that level, and then now it's like, now I'm at the psychiatrist versus all those things that
you're right. Like
all those things those things that you just described about being aware of, like, that time course or being aware of the biology, or all these things that you're mentioning, which the typical person is obviously unaware of, and then that just perpetuates itself until they get to that time point where they might need a psychiatrist. But geez, that would have been so useful more towards the beginning of that journey. And so how do we start to normalize that from a medical sense, like in terms of how you think about it? Are there ways to integrate some of these things more easily and take away some of that stigma?
There are a few things we're trying to do. I mean, and I hope to be part of the conversation. I mean, I should just say, since I've been in medical school, I've been in therapy and working on my own mental health. I mean, I think that's when people think of the example of a mental health patient, one of the things that struck me in my time in the field is it just looks like everyone else. There's not any, it's not like we know. And maybe that's sort of obvious to everyone, but I do just encourage people to speak up about their own mental health. I think that in terms of what we do for men, I think there's a big opportunity to really decrease stigma in terms of not having it be what I always hear of, like, what brings somebody in is like their partner said they should come in, or someone said they were concerned, right? And that we get away from this notion that, it's masculine to not get help, because that's just garbage. That's why 75% of suicides in America, completed suicides, are men. They're middle-aged white men primarily. And then also there's a statistic that floats around, like, the rate of depression in men is about half that of women, which I think is total BS as well, because the rate of substance dependence in men, lifetime risk of substance dependence in men is 49%. So 1 in 2 men is going to be addicted to something or dependent on something in their lifetime. But in terms of awareness and next steps, I think there's just the reality check of where's your mental health? Do you check in about it? Do you think about it? And some of the tenets of that, as a psychiatrist, think about affective stability. Like, is your mood, like, where is your mood? Is it up at, like, what's the range of it? How much does it go up and down? And kind of how aware are you of what affects it? Now, I'll hit some pretty low moods, but, like, I know where that's about. And I also kind of know how to get myself out of it, usually. I think there's also one of the big skills is the talking and expressing what's going on inside with people. I think there's a lot of hesitancy that people have to do that. And so getting used to that and working on that with somebody. can
Doc,
be
I've
a
heard that
horse like me.
I've read as well that depression in men will, we often have this idea of just the lower mood, the sadness, this sort of these types of symptoms when we see, more things around like that, more like anger outbursts or like that kind of,
men aren't the sad. I mean, they're definitely, you can get them teary. Like sometimes there are a few like the sad, more tearful men, but usually it's irritable, angry, shut down. I call it defended, right? Where it's just, or men talk about how they go in the bunker.
Okay.
And it's like, how you doing? It's like, I'm good. It's like, really? You seem hostile and angry. It's like, nope. Like you must be wrong. and I think all men, not all men, but a lot of men know that, right? And I wouldn't say it's just a male thing. I think anytime people feel hurt or misunderstood, they emotionally shut down. I mean, I think it's how we make this like, men don't like to talk about their feelings. And it's like, no, I treat lots of men. I sit for 45 minutes and men just, they talk, I talk. All we talk about is feelings the whole day. I talk to men about feelings. So I don't think it's in any way accurate to say men don't talk about feelings or their brains are wired differently. I think that all this is total hogwash.
Okay.
I think that we have a culture that doesn't promote emotional vulnerability among men. And that sounds like some weird touchy-feely thing as opposed to like, I think what actually makes men who sort of get into this stance just probably some of the strongest people around. Just really an ability to know the self, to know others, to be connected, to be thoughtful, helpful, and really mentally healthy. So.
Yeah, it's interesting. We see a shift, kind of parallel this with coaching. Again, 20 years ago when I was playing basketball, it was a lot of cracking the whip and yelling. I'm not sure how it was on your JV team, but there's a lot of yelling, and this is how we motivated and that type of.
I'm a Hoosier, so Bobby Knight is like Bobby Knight. Like if the coach doesn't hit you with the chair, it's like I don't know. He doesn't. It's like he's not passionate.
Exactly, and obviously today it's a much different. It's a bit more tuned in on the emotional side, which sounds like a good thing. And if we circle back to your, you mentioned biomarkers previously. Are there certain ones? You mentioned things like B12 or iron or thyroid that we're looking at that might be able to move the needle, and to a certain degree.
Sure. I mean, the first step, if you have a depression or severe anxiety, especially if you haven't talked to somebody, is to, see your general doc or a general doc or go to a doc in a box and just make sure that's, I always like this as a first step is like, you don't even talk to a therapist. You can just get basics. And so I check out everybody's thyroid, which is just, we get a TSH, basic thyroid sort of marker in terms of telling us whether something's off. Vitamin B12 and B9 are just two dietary components that some folks, for example, don't absorb B12 very much, or as people move towards a plant forward diet, they consume less B12 and less absorbable forms of zinc and iron. And so checking for an anemia if people are tired and fatigued or, losing their hair, or B12 deficiency. Yeah, those are some. Vitamin D, it's funny, there's not tons of data about vitamin D and mood, even though we all associate all the studies. Like if you give people massive doses of vitamin D, like I'm going to prevent depression this winter. It's like none of the studies have been positive in that. But there is a correlation if people have depression of low vitamin D worsening depression. And I would say, it's a vitamin, like you should have a normal level no matter what. But I'll check vitamin D. Inflammatory markers these days, things like CRP, homocysteine. For a while, I was checking MTHFR genes, but it doesn't really look like that pans out in the data so well currently. So those are some of the markers that, are part of just a standard. There are a few other things. You should check people for syphilis. There's end-stage syphilis that can cause us, not as common as it used to be, but, just basic kind of medical workup for depression.
Yeah. Yeah, no, it isn't interesting how even, like high blood sugars, as you mentioned before, this inflammatory terrain.
Hemoglobin A1C, sorry. That would be another one I love to check. Hemoglobin A1C, lipid panel, or just to kind of know.
And it's interesting how, obviously we're, docs are seeing so many people who are really unwell. And so when people have levels that are sort of high normal or hovering, oftentimes it's the wait and observe approach, which is fine, but then it's sort of with the time crunch.
That works. Do you think that works? I don't think that's working for anybody.
That's what I think.
I don't think that works for anybody.
We're sort of just delaying, not
one of your pro athletes was like, my lipids are off, my sugar's off. Like, I don't feel in good shape for this season. You wouldn't be like,
give it 3 months.
Let's see what happens. Let's see, good luck. You get super involved. You'd start trying to motivate them. You'd understand. You'd wonder where their motivation is from. So, Yeah.
And to your point, these small changes of just adjusting this or being able to layer things in, which I think is always a big benefit when you're, GP or a doc, if you're going to see somebody regularly. But those are, changing people's behaviors is obviously not easy. So any insights on your end of how you help to nudge people in the right direction to start to make some of these behavior changes?
It's interesting because I come at this from a therapist standpoint, and as a therapist, we're very gentle in that, where the idea of people becoming internally motivated because of me or my goals is something we really kind of are against almost. And so I think that with motivation, I love the motivational interviewing framework of really trying to understand where somebody is. Are they contemplating change, or are they like, no, I've not even thought about stopping smoking? And so I get to, what I like about that mindset, instead of my job is like, I'm a doctor, you've got to stop smoking, stop it. And they're like, okay. Yeah. I'm like, good. See you next time. You stop that bad thing. Yeah. That never really worked for anybody. And it just turns, healthcare professionals into, I don't know, like hall monitors. And instead trying to understand what my job is, right? That somebody, where they are, they're not even thinking about changing their diet, or they're missing skills, or they want to, but they don't have time. Where now, we're in a conversation about really your life. And I get to be looking for little areas and aspects where maybe I can help you with motivation and with small steps. It's where with diet, there's so much to do. And I think instead of focusing on like, you should go keto, you should stop eating meat, I like just focusing on these food categories. Like if you're worried about brain health, you should think about seafood. That's like the best source of long chain omega-3 fats. Everybody's worried about whether you should eat too much meat or not, or this much meat. And I think the data is all clear. People aren't eating enough seafood. I think the more seafood that we can eat and the more we can focus on protecting our oceans, the better for all of us. And it just then leads to a question of like, if I were with you, like what's your relationship like with seafood? I'd be looking for my favorite fishies, the anchovies and sardines and wild salmon in a can, just because it's shelf stable and easy and inexpensive and accessible to more people.
Yeah. And on that note around, trying to understand people and where they're at, this idea of trying to get a sense of people's values, what are the things that are important to them in their life? And oftentimes when we can juxtapose the behaviors that they're doing to, where their values are at, can help people start to move in that direction. Is that something that, I imagine obviously with your intake techniques is, you're evaluating that, but in terms of some of the techniques you might use with clients, or their exercises that you might do, or ways that you're evaluating that might help practitioners who are listening in?
Yeah, for sure. For practitioners. So we have a clinician training program where I go over some of this in detail, and I'll share some of it again. It's going into some details about motivational interviewing techniques, and it goes over our brain food evaluation, which is, for walking through somebody's day in a life as an eater, looking at these key food categories, thinking about some of the key nutrients, and then really thinking about how do you partner and form alliance with people. It's where the food work, because people so often expect to be judged or told like you've got to eat this way or that way, that I think folks are really welcoming to having more of a partner in this, whether it's just, somebody's paying attention and cares, to you can brainstorm with somebody. Like I had some gut issues a couple of years ago, and so we have a great health coach and therapist in our clinic, Samantha Elkreef. And, I was just talking with her, and just in a couple minutes, and all of a sudden it was just in my mind that as I felt a little upset, I kind of heard her voice like, hey, don't forget root vegetables, and like keep, hydrating, and don't, it sounds like a lot of this is stress around your eating, and can you like de-stress a little bit before? And just these little, nothing that was rocket science, but in some ways it was brilliant because it was just with me. And it just helps kind of, as you see with any coaching or athlete, right? If you have a target, you're working towards something, it's concrete and it's clear. And as you take a step forward, you see yourself get closer. That's hugely motivating for people. I think the caveat is with mental health and with food and with overall health, sometimes people are a little too short-sighted of like, we wanted to eat it and like, I'm better now. As opposed to you're eating regularly healthy stuff, and over a series of weeks, your energy, your sleep, your focus, and your overall perspective is going to improve.
100%. I mean, that idea of kind of trusting the process and being able to actually go through that and let it play out is obviously a huge part of it. my first question on that is, do you guys, are there some strategies that you guys have, or ways that you implement it to be able to support that trust the process journey? Or is it more around the fact that people are coming out and seeking you out, and so they're already, somewhat bought into that process to begin with?
Well, I think oftentimes our food work is integrated into our overall mental health work. And so we tend to really try and understand and establish good frames with people of how we get to have time and space with them to approach their mental health and engage in that process. So usually our food work, not always, but usually is in the context of some other work and other things that are going on with people. I think that in terms of getting people engaged, I my sense is until people are interested, excited, thinking about it, want to talk about it, I'll do some talking about it, but I think I'm a little sensitive to, I definitely don't want to be a brain food expert selling brain food to people who aren't excited and interested, just in the sense of, I guess, much my clinical technique of, if you want me to help you heal your depression, you don't want to talk about food. It's like, I don't know. I see my job as helping people heal from depression. And so I figure there's an opportunity to talk about sleep, talk about therapy, talk about meds, and then I bet over time somebody's going to be curious what I have to say about food. But in terms of clinicians incorporating this type of work, I think it really starts with getting comfortable talking about food. I think understanding kind of where your lane is. I think because it's mental health, a lot of people in the nutrition world are a little hesitant to, because they're going to be treating mental health. Even psychologists and social workers who are, really hardcore mental health professionals, I'll hear them the opposite. Like, am I allowed to talk about food? And I think this is where professionals need to remember they're professionals, right? Like I'm not a cardiologist, but if you ask me about your heart health, I'll give you a couple of thoughts. I'm not a primary care doctor, but if your high blood pressure is up or you're having headaches and you haven't checked, I'm going to do my job as a doc and kind of say a few things. And I think the same thing comes for sort of both sides of the aisle. I think so many coaches and nutritionists and folks in the wellness world end up in some ways having a really heavy caseload of mental health concerns. I just hear this from a lot of coaches where they're dealing with so much that people trust them, and it's not, an intimidating doctor's office, and you hear a lot. And so I just hope everyone hears my support that, in many ways coaches are kind of front line of the mental health system. And so I think handling that and then having place to kind of process and discharge it is important, and just understanding it is emotional labor and takes effort, but also just to not have it come across as you're telling me all this really heavy mental health stuff, and now I'm going to tell you to stop eating cornflakes so you can fight inflammation, which, I think that's sort of obvious, but it's important to say that it's in a context. I usually put it in a context of, here are some ways that you're feeling, and can I share with you some ideas I have about maybe some things, concrete things that you can do. And I'll try and separate that out. Like, I hear you're having a hard time, that, like, in your case, you're not getting a lot of playing time, you're depressed, you're on the fading part of your career.
Three kids at home, I can't sleep at night.
Yeah, right. It's like, it's so that I'll think, like, what, where can there be some progress, right? Like, where, like, sleep was all, parents. It's something where, how can, that's why I got one of these like rings. I started tracking my sleep. I really like, it's time to make a change. And then thinking about, in terms of food, in nutritional psychiatry, we just think about food categories. And again, trying to focus on some of those. I'll look at my plate. If I don't see any plants besides, like, I don't know, spaghetti, it's like, okay, like, I'll add in some plants. I'm looking for rainbows. I'm looking for seafood. Those are some ways that I think, but I get to your point of, I think the more that you get a conversation going, I'm a big believer. I ask people a lot of questions. I think part of the luxury of people thinking you're an expert is, like, I just get to ask people, and I love hearing the answer. Like, how do you think your food is related to your mental health? Like, I don't really have to sell it, because people say, oh, and they tell me, and it's on. And I said, okay, like, where are some concerns you have? And they tell me. And it's nice. It's great. And then we'd say, all right, what are some, usually the job is really wonderful too. And say, tell me some solutions. And people tell you, and it's one of my favorite parts of my job, which I realized early in my career, it's not so much that you have a smart idea. It's that people are really brilliant, and you kind of help get them aligned in a way to get that out and have confidence in that. That they are really clear what they need to do. They're really clear often how to do it. Maybe we can nudge here and there and help with a little technique here and there, but.
Awesome. Yeah, that's very well said. And if we circle back quickly on a couple of things you mentioned there around exercise and sleep, can you walk us through a little bit of what where the data is at in terms of low mood and whether it's lack of fitness and lack of sleep, and how these things can mount up and impact them? things like low
Yeah.
mood and depression?
So for sure, the data is pretty clear in terms of like mental health vital signs. Sleep is up there. Sleep and nutrition are probably the two most modifiable. Exercise is equally important, but if I had to pick two of the three, I'd pick
Easier
sleep and
places to start,
nutrition.
right? Yeah.
Yeah, I mean, yeah. Ideally, we want people engaged in all three. How can you have good sleep hygiene? And beyond the basics, we have a new mental fitness course that we've been working on, where we really try and get into some of the new science of sleep. Because so often people are like, "Yeah, I sleep 8 hours," and then it's like you
Do you
talk to. I
really?
mean, I've interviewed like that. I mean, like
Yeah.
hundreds of people, thousands of people about their sleep, and especially if you've spent any time monitoring your sleep or looking at sleep data of other people, it's really it's an epidemic right now in terms of people not valuing sleep, people not understanding sleep is where our brain really goes into kind of a wash and clean cycle.
Mm.
That's really critical and requires us going through our very sleep cycles. All kinds of stuff we use to sleep messes up our sleep cycles, from sleep meds to CBD, which, by the way, in the research is CBD is a wakefulness molecule. Like that's how the researchers talk about it. It's not actually, doesn't actually promote sleep, but don't mind science. So there's but things like that, alcohol, sleep meds, CBD, which melatonin even, just shift our sleep cycle. And so the idea is really, can we work with people to help get back onto a really natural sleep cycle by getting the body and mind tired via exercise and having meaningful experiences, and then really controlling light, lots of early morning light, and then really the sun goes down, lights go off. So
Yeah, and just the last couple of questions here for you.
oh, wait, and you said exercise. We just say the exercise. So about 10% of worldwide depression would be totally prevented if every adult in the world exercised between 120 and 150 minutes a week. That's what the researchers estimate. I think anybody who's struggled with their mental health knows that exercise gets really hard and exercise is always really good. That when you're struggling with depression and you don't have energy, if you can get out and work out a little bit, you feel a little better. Even if you're exhausted, when you have anxiety, nothing helps you with anxiety more than exercise. So
yeah, it's always that tough loop, isn't it? Of like, people are working hard, they're working longer hours. Now they don't sleep as much. Now they don't have time to exercise, and now they don't eat as well. This whole, downward spiral starts to happen. And just on that note around, alcohol, obviously, or caffeine, even. I mean, people, busy running on all cylinders, and it's like, all right, let's take the edge off with a couple glasses of wine. And to your point of wearing the sleep monitor, we can see how that affects the heart rate overnight.
Oh, you see it, right? I mean, this is grape juice, not exactly the healthiest, but healthier but you'll see it. If I have a couple of glasses or whatever, you go to bed, my heart rate is like high 70s, sometimes low 80s, but usually high 70s. And it takes all night to get down to like 45 or 50, 55. If I don't have anything to drink, I go to bed and my heart rate drops to 50. And you just think about that night after night where people, are chronically having a couple glasses of wine because that's the recommended healthy amount. And it's, nothing. I'm not a teetotaler. I don't have an issue with people having a drink every now and then. I just think that we, just like I had my little rant about modern masculinity, I think we're also in a culture, just there's a lot of promotion of drinking in a way that when you think about top headwinds to low mood, it's definitely going to be some of these sedentary lifestyle and dietary factors, but definitely alcohol consumption is way, way up there.
Yeah, I know for sure. And on the supplement front here, wrapping things up, do supplements, is there anything out there that might move the needle for folks, or is it really, obviously the pillars being, nutrition and exercise, and these lifestyle factors, of course, on top of actual strategies that someone like yourself might use with a patient. But what about on the supplement front? Is there anything that's actually moving the needle these days?
There's a little bit of data, I mean, on the supplement front in terms of natural antidepressants. There aren't a lot. I mean, and usually I think what happens is people kind of avoid treatment and they come in often taking like 4 or 5. They're taking magnesium and St. John's wort and rhodiola and some mix of adaptogens and reishi mushrooms. And those are all things that have some data behind them. I would say what stands out in the data probably most recently is around, I guess it's not a supplement, but certainly around the psychedelics. Certainly 2 interesting studies in psilocybin.
Yeah.
I think good data around St. John's wort. I'm a fan of magnesium and more of that in people's diets. And sometimes, there is some data around supplementing that and getting better outcomes with depression. And then there are a few in terms of, calming people down with a little bit of data. Again, I don't mean to sound anti-CBD. I just think it's one of those things where there's really no data.
The hype's really high, and
the hype's really great, and the doses were like to get an
therapeutic dose cost you $1,000.
Yeah, well, you're talking about like 600 milligrams in the study, or there was a study of improving mood and affective expression in patients with schizophrenia, and I think it was like 1,200 milligrams a day of CBD.
Wow.
So, and also again, just no real data. It helps with anxiety, but all that said, something I've seen lots of people experiment with and have good results with in terms of feeling it helps their sleep, feeling it helps them be calm. And so, I generally tell people to work in conjunction with a professional, because it happens a lot where someone will start something, whether it's St. John's wort, Zoloft, psychotherapy, and then a month later they're like, yeah, I don't know if it's working. And you're sitting there like, oh my God, are you kidding me? Like, really? Like your mood's better. You're having a good time in your relationship. You're smiling, like you're cracking me up. You're in such a good mood. Yeah. And, but it's
hard for them to see it.
I'm being a little silly, but sometimes it's not so apparent to us how something is affecting us. And so that's where I think, I'm a big believer in trials, right? If somebody says, what do you think about this? I'm like, let's try it. Let's try it for 4 or 5 weeks. Let's try and get a good accounting of what we're looking for to change and whether it changed or not.
Terrific. Well, listen, I won't hold you here much longer, Dr. Drew. Last question for you is, if you had to give people, one tip, again, this sort of midlife, busy, sleep deprived, around supporting mental health, what would that tip be?
Well, I would say for all my middle-aged kin out there and folks, I would say that the parts that have been most important in terms of having a good time in middle life, I think that there's the processing of trauma that oftentimes doesn't happen as we're working hard to sort of achieve things and establish relationships and establish family and partnership and professional identity and all that. So I think for the 40s, there's a lot of let's say, turbulent emotional stuff. It gets framed for us as either you're going to have a midlife crisis, right? Or I'm not sure what the other options are. and I think there's a lot of way to not have a midlife crisis is if we really understand that our development doesn't stop in adolescence. And there is this, I think, very intensive period as parents are getting older, as kids are young and then rapidly getting older. And as career hits a kind of stride in the 40s, where I guess it's a strange answer. I'm supposed to say brain food. Sorry. Yeah. Eat more brain food. The one thing I want you all to do, I want you to feed your mental health and
eat more oysters, and it'll all be better.
More fish and oysters, more. I say seafood, greens, nuts and beans, and a little dark chocolate. But nice. What pops into my mind, besides plugging the book, is reminding people to deal with trauma, and that doesn't have to be. Oftentimes when I say trauma, people are thinking about assault, rape, sexual abuse, and certainly those are horrible traumas. My definition of trauma expands a little bit. That if you've been bullied, if you've been the subject of racial violence of any type, if you've been discriminated against, if you have been under the thumb of someone, it doesn't have to be a racial thing, someone who is somewhat sociopathic and treated you poorly. Not that we're all victims and that we've all had trauma, but that I find so often with people, there's some other moment or sequence of events or relationships that's really, really traumatic to them. It really kind of shakes their foundation that they haven't worked through or talked about. And it ends up, I think, in middle life playing out for a lot of folks. So that would be, besides the brain food, that's if you want my late night.
I like that. We got both levels there. That was tremendous. Listen, Drew, I appreciate you carving out the time. The book is tremendous, so definitely encourage everyone to pick that up, and we'll have the links in the show notes as well. Where's the best place for people to stay connected with you and keep up with your fantastic work? On Instagram. Everybody should I try to post if you want to see my pretty horse and watch me flail with my own mental health and fitness. But my website, drewramseymd.com. I've got some great free downloads in terms of brain food on a budget or some of my other surprising mental health foods and some recipes. So please check those out. And please do stay in touch. My goal is to help people feel really empowered in terms of caring for their mental health and continuing this conversation, not just around food, but around our overall mental fitness. So I really appreciate the opportunity to speak with you all and to speak with you. And I'll look forward to, you've asked some really great questions about performance. So I'm going to come back on and ask you some questions. Fantastic. Well, until next time, I appreciate it, bud. All right. Take care. Have a good night. Take care.